Today, we're talking about hospital stays, an experience that can feel overwhelming for both patients and caregivers. In this episode, we'll explore practical ways to navigate them with greater clarity and confidence. So stay tuned and we'll get into it. Hi, Dr. Lakelyn here. Welcome to Caregiver Chats. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. I'm so glad you're taking the time to join me. These conversations are a space for learning, reflection, and support. And I invite you to subscribe to Caregiver Chats on Apple, Spotify, or wherever you get your podcasts. And don't forget, I love hearing from you. You can email me anytime at caregiverchats@homeinsteadinc.com. When an aging loved one is admitted to the hospital, it can feel confusing, overwhelming, and stressful. Who do you talk to? What's really happening behind the scenes? And how can you make sure your loved one is safe and supported while in the hospital and after they're discharged? Joining me today is Dr. Monique Nugent, a hospitalist, physician leader, and author of Prescription for Admission. Dr. Nugent has dedicated her career to improving the patient and caregiver experience in hospitals, and she's here to share insights that will help you feel more prepared and confident during one of caregiving's most stressful moments. Welcome, Dr. Nugent. Thank you so much for joining me today. It's so great to have you here.
Thank you. I appreciate the chance to talk to you and your audience.
Well, the pleasure is truly ours. And I thought it'd be great to have you start by sharing a little bit about kind of your background and what led you to focus on hospital medicine and patient advocacy.
Yeah. So the way that I came and decided to be a hospitalist really boils down to residency. I think you go through medicine, you try on all the different hats, you figure out what you want to do in residency, but residency isn't where it ends. A lot of people go on and do fellowship. So when it was my turn to start thinking about what type of fellowship I was going to apply to, I really was between critical care medicine, endocrinology, and infectious disease. And I had a mentor who said to me, whatever you pick, you, number one, have to be able to do it forever. And number two, feel like you can have the biggest impact. And that really narrowed down the field for me pretty quickly. I loved critical care medicine, but it was such an intense and high stakes clinical situation that I felt like I just don't know if I could do that forever. So I kind of put that to the side. And though I loved endocrinology and diabetes teaching and thyroids and adrenal glands and infectious disease, I felt like, I don't know if this is a thing that I feel like I'm making the biggest impact. And I came across a non-clinical fellowship in healthcare policy and management, really focused on healthcare disparities. And I went off and did a fellowship in that, healthcare policy and management at Harvard. I got my master's in public health, spent time really learning about what it means to do good active work. What are health care inequities and disparities and how they're built into the system? And I said, that's it. That's what I can do forever. I can work to make the system better because there's so many different ways to do it. And I can work to make the biggest impact because if I'm making an impact in one system, it's not just one patient, it's every patient that comes through that system. And so really that's how I decided to get my master's in public health and stay focused on hospital-based care, really focusing on making the environment of hospitals safer, more equitable, more efficient, and a little bit more pleasant place for patients to be.
I think it's always so interesting to hear people's career paths and why they go into the field that they're in. And I love that you want to make a difference in that way. And you are making a difference in that way. And you've also become an author and a fellow podcaster, and both are called Prescription for Admission. And so would love for you to share. Oh, yes. Oh, there's the copy of it right there.
The copy of the book. Yeah. This is another passion project about making things better for a group of people. My book came about because during the COVID epidemic, hospitals were a very different place than they usually were. Hospitals, I jokingly call them the DMV of healthcare. People are in and out. Everybody's always there, right? And everyone's not excited to be there, but they're there. All of us at some point in time, show up in the hospital, either to visit a family or friend or as a patient ourselves. But the pandemic really changed that, in that it closed the doors. And what we had were just patients kind of by themselves. And as much as people think that we may not like to have visitors or have family members, we really need family members and caretakers and advocates at the bedside. It makes a huge difference. We have not met your loved one before, right?
Yeah.
I don't know if this is mom or dad's normal mental status, if they are normally a little bit confused and forgetful or not, right? People have trouble remembering things and advocating for themselves and speaking up for what a safe discharge plan would look like. And so I thought, oh, I'm going to make this pamphlet, and it's going to teach people how to communicate during the time of COVID. But as I wrote the book, I found I wasn't coming up with anything new. I am a hospitalist through and through. I've worked in hospitals on both coasts of the country. I've worked in VA hospitals. I'm now at a community hospital, tertiary care centers. I've worked with residents. I've worked by myself. I've been in multiple ways of caring for hospital stays as hospitalized patients, and it's all the same problems over and over and over again.
That's so interesting.
Yeah. And so in the book, you will not find the word COVID at all. Because what I found I wrote was a guide, a general guide for the things that you're going to come up against, for the problems we know exist in healthcare. And so really it was, in the end, something for everybody, for all time, not just that like extenuating circumstance.
Wow. Well, and as caregivers who are the audience of our podcast, so often they find themselves in the hospital setting. There's so much unknown. And to your point, they are such an advocate for the person they're caring for, and can be such an asset to the medical team as they're trying to, figure out what's going on and plan the next course of action or the discharge. And so I know, though, caregivers often say, my loved one has been hospitalized. It was such an overwhelming experience. So Dr. Nugent, why is it that it is so overwhelming? What makes that situation very overwhelming?
Caretaking itself is an all-consuming thing, right? It's an all-consuming practice. And you build systems that work for you in your world, in your home, on your schedule, with your people and your food and your preferences, and all of it works well because it's yours. But then you leave that and you come into a hospital, and now you're on my schedule, right? The medication times that we give may not be the medication times that you give and you and the person you're caring for are used to, but they work with our nursing schedule. And because it works with our nursing schedule, that is now gospel. And the food is different, and the room is different, and the place is different. And then you have 5 different people coming in the room every hour telling you 20 different things. You have questions, you have concerns, you don't know who to give it to. It's all this lack of control that happens with a hospital stay. That the reason the hospital works the way it works is because it has to support a bigger system. It has to support not only the people who are hospitalized, new people who are coming in, emergencies, people coming for appointments, all of these things. So it's built to support that. You and your person you're caring for, you're built to support you. And we take you out of your environment and we put you into a totally different environment, and you're already sick, and you're already confused, and you're already in pain, and you're already in need of help. Right? So it's overwhelming because you're already out of control. You put into someone else's center of control. And then we're just supposed to expect you to just go along with it. It doesn't work that well. And so caretaking is already all consuming. A hospital stay is all consuming. You can put the two together. And that's just the tip of the iceberg. It just depends on other things too. What are you caring for someone for? Is it dementia? And being hospitalized now puts them at risk for more confusion, poor outcomes from that. You're worried about falls. It's difficult because unfortunately you're out of control.
Yeah. Well, and I think many caregivers like to be in control. So that
You have to.
that in and of itself
Yeah,
can be,
yeah.
you know, really challenging to navigate. And then you're right. There's so many people coming in, and so many maybe new terms being used, and
Yeah.
you know, a lot of questions being asked. And you know, usually the family is the best person to answer those questions because they know the person best.
Yeah.
But it still can be very overwhelming. So if a person, a caregiver, care partner, is, you know, preparing for a hospital stay, or maybe it is an unexpected one that they have in their future, what are some of the common things that they can expect during a hospital stay? Maybe it's like the terminology, maybe some of the processes, because I think what's so wonderful, Dr. Nugent, about the work you do is you kind of lift the veil and give us a peek behind the scenes on what the hospital is dealing with, because you're right. They're having to navigate so much and to provide the best care possible for the patient. So, you know, there's likely maybe a little disconnect between the two, but I think understanding where both sides are coming from can be really helpful.
Yeah. The number one thing to know is that your communication, your participation is key, right? You're communicating to us not just what the person needs, but what they're capable of, right? When we ask for medications, giving us correct information. I say own your information, right? If you know, you don't have to know everything, but if you know where to get the information, that we can get it, it's consistent, it's correct. If you're able to help us continuously get information, that builds safety, right? Because now I know the medicines are correct. Now we know that they need a soft diet, or they can eat a regular diet, or they need thickened liquids. All of the things that are necessary for safety really hinge on information and participation. And so you really want to focus on safety. And if you stay focused on safety and participate by giving more information, participating with communication, setting clear communication goals. And that's a big one. That's a really big one, because we may not always know who to speak to for lots of reasons. And so without clear communication goals, you end up setting you up for disappointment, me up to disappoint you, and us to be frustrated. And the reason why I really do push that, you know, own your information, set clear communication goals as two of the biggest things to help with a hospital stay, is, like I said, communication, information safety, right? The more information we have, we can build a safer plan for you in every way possible. If we know dad is prone to wander, there are hospitals that have special units for patients with dementia, right? I went back to diet. That sounds like a not big thing. They're like, oh, really? They need soft food, but that's a choking hazard. People can, right? You can choke and aspirate and have really poor outcomes from that type of stuff. That it sounds like a not big thing, but it is. It's a safe, big thing because it's a safety thing. So own your information and communicate that information. And then going back to setting clear communication goals. So what happens is this. People come into the hospital. I may not have met you down in the emergency department. I meet mom and I talk to mom. Mom seems fine. She seems okay. I think she's alert and oriented. And then I go about my day, and then I come by, I see mom again the next day. How are you doing? I'm great. Is there anyone I should call? Oh, don't bother to call my daughter. She has to take the kids to lacrosse practice and this and that. So I don't call. Then the next day, okay, everyone's doing okay. The third day, daughter shows up. No one's called me. I have not heard from the doctor. I have not heard from the nurse. I am my mother's caretaker. I am the person who coordinates my mother's care, and nobody called me. If we don't know to call, if we don't know whom to call, if we have not been given permission to call, sometimes, right? There are clear cases where it's in the chart, like health advocate is activated. This person cannot make their decisions for themselves. But there are other times when, like, yeah, you take care of dad, but that doesn't mean you are the person making every single decision for him, right? He may still be quite capable of making his decisions. If we don't know, then everybody's upset. And so what I say is this: on the first day of hospital stay, that is a hard day. That is a long day. That is a miserable day. You're going to be in the emergency department for however long, and that's a very different conversation. Then you'll wait to meet me. You get moved upstairs. You want to make sure you go through all the medications and you know what room they're in, and that they have the call bell and all of these things. That's the long day. And in that long day, you're going to make sure that I know who you are and what the expectation is. Hi, I'm Dorothy. I help take care of Dad. I'm really the person who helps him navigate all of his care. And then, the introduction. The second thing you're going to do is give me a clear expectation. Can you give me a call after you speak to the cardiologist? Now, why is that? Why do I want this clear expectation? 2 reasons. 1, you want to tie that expectation to a thing that we have to talk about to drive the care forward, right? Not just call every day. Oh, just call every day for an update. You're not looking for an update. You're looking for information to make decisions on to drive care forward, right? Can you call me after the chest CT? Can you call me? Clear information so that when I sit down, I'm like, oh, I spoke to the cardiologist. I need to call Dorothy. Number 1, I'm very aware of that. But now we have something to talk about. And this is what the cardiologist says. And this is our plan, because you want to move things forward. Right? So by sharing your information, having information, owning that information, you're ensuring safety. But by setting clear clear communication expectations, right? You drive the conversation. And then what happens? I feel good about reaching out to you. You feel like I have, met an expectation. Our therapeutic alliance is stronger. We're working as a team. Or if I don't, the next time you speak to me, you did not call me after the cardiologist. I was expecting the call. What happened? Right? Now I have to tell you, I actually didn't run into the cardiologist until this morning, or the cardiologist didn't see him until this morning. Or, I am sorry, I did not do that. And I have to work better to meet that expectation. It doesn't have to be antagonistic. People often say that, like, I don't want to ask the doctor. I don't want to seem mean. I don't want to, it's not antagonistic. If I'm failing at something that I don't know I'm failing at, and then there's a blow up, that's antagonistic, right? But if you set a clear expectation with me, or I set a clear expectation with you, then what we have is a partnership. So I have a very good friend who's a hospitalist as well. She does this on her end. So every time she admits a patient, she makes sure she goes out of her way. She makes sure she reaches out to whoever it needs to be and says, I will call you when something has changed. I will call you when I speak to the cardiologist. She sets that expectation so that, she, again, makes that therapeutic alliance strong, but she feels like that people are getting the pertinent information. And if people, say, okay, and then also after this, they can have a conversation and say, okay, let's maybe have a family meeting or whatever. But, she's really great at setting that expectation with families. And she says it makes, families feel happier that I'm communicating with them, but also makes her feel in control, that sometimes she doesn't have to call every family every day. Right. Because she's already set things up and people know where things are going. If there's nothing changing, maybe she doesn't need to call.
Those are such great tips. And I know I hear from families so often that they get frustrated because they haven't heard, or, they just don't quite know the full picture. And so having those clear expectations, or having that clear communication, can really be a game changer. So I think those tips alone are so helpful, and I hope all that are listening kind of log that away for future hospital stay, because most certainly that is key to that communication. I think you brought up something that's also very common, is sometimes older individuals or even caregivers are afraid to ask questions, or hesitant, or they think they're stupid questions, or I probably should know the answer to this. And that can probably contribute to a breakdown in communication, I would assume. But any tips for families in terms of like questions to ask, or just encouragement not to be afraid to ask the questions.
Yeah. So, I mean, we heard it when we were in grade school, right? The only stupid question is a question that you don't ask. Right. And please don't assume that someone is going to get frustrated or angry. And if they do, then I think that's fair to ask, like, why? Hey, all I was doing was asking a question. Is there something else going on here? And if you feel like you're not being communicated with, how can you escalate those concerns up the chain of command? Because everybody's got a boss, and it's no different in the hospital. But I want you, instead of thinking that like, oh, this is the nurse and I shouldn't, ask questions and the doctor knows what they're doing. Instead, I want you to think about this. This is my teammate. And in order for us to do better as a team, we all have to be on the same page, right? So I have never played football a day in my life, but I'm pretty sure that when they huddle, they're talking, right? That's when the plays are being told as like where they're going to go and what they're going to do, right? The only play I know is like a button hook, right? So are we going to do that button hook thing, right? So this is our huddle time. This is the time for us to all get on the same page. And the only way that happens is if I ask questions and if I participate. And I'm going to ask you questions too, as your physician, right? That's why it's called a conversation. You ask, I answer, I ask, you answer. We are doing this dance of words together with the goal of making things better for you. Now, no man is an island, including caretakers, right? You hopefully are not doing this alone. Hopefully you have some other support system, some other people who are invested in what's going on as well, right? Particularly as people are hospitalized at, older, more frail points in their life. I see there's lots of children who may be involved in decision making. If everybody feels like no one's getting what they want out of the conversation, there's lots of different questions. The one that I get is like, oh, I have like 6 brothers and 12 sisters. Do you mind just giving each of them a call in the evening? Like that's not only is that not possible, but what that does is that sets up really bad communication because different people ask different questions. Different people understand things differently and get different things out of what I say. So if you start feeling like there's all these questions buzzing around, no one's on the same page, and I start feeling like that too, this is when I encourage people to call for a family meeting. I say, Doc, there are other stakeholders here. I may be the caretaker, I may be the healthcare proxy, but I don't make these decisions in a vacuum. There are other people who are helping me make these decisions. There are other people who are involved in dad's care out of the hospital. How can we get together and have a meeting where we can all hear the same answers to the same questions at the same time? And this way, everybody gets to be on the same page. And the point of the family meeting should be planning next steps. Shouldn't just be answering questions. If you come out with questions answered, that's great. But there should be, where are we going next from these answers? Where are we going next? And it's just another really great communication tool, right? Because hospital stay rarely ends in things getting easier. Often ends in things being different, right? And what does different look like? Where do we go with different is really the important part of a hospital stay, is the discharge, getting out of here in one piece to go on to the next. And that takes a lot of planning and a lot of working together.
I'm so glad you brought that up because I did want to talk about kind of what happens after. But I love the idea of a family meeting, getting everyone on the same page. And I've heard you say this a few times now. So, planning for what's next. Yeah. And I know so many people say, I just want to get out of the hospital. I just want to go home. So, you do have to get to some of those next steps in order to make that a reality. So I really like that suggestion of keeping, okay, what is our next step? What's the next course of action? Kind of as a talking point with the healthcare provider, with within the family meeting, so that everyone is kind of moving forward together on that plan of action. But the discharge planning, setting yourself up to leave the hospital, There's a lot that goes into that too. So
Yes. Oh, yes.
I know that there's,
Yes.
successful hospital stays, but there's also successful or unsuccessful hospital discharges. And so, what are some things that families should be thinking about, or who are the kind of key players within the hospital system that they'll likely interact with as they get ready to discharge or leave the hospital?
So discharge planning starts on the day of admission. And I know people bristle at that. I know people think like, how can you think about getting us out of here when we just barely got in? And what I mean by that is when somebody comes into the hospital, I'm often asking questions about where they were and how they functioned before, and thinking what we need from where they are now in the hospital to either get back to that, or if getting back to that isn't possible, will we have to think about some other ways of being, right? And the number one person who is going to help you with your discharge planning is going to be the case manager. Some hospitals might call them case workers. Sometimes they're social workers, but case managers are nurses whose job is to help with successful discharge planning, matching your medical needs to the community's needs, to your needs, to your capabilities, and also your financial situation. I never, ever, ever want people to forget the financial part.
Right.
It is a part of healthcare discussions here in this country, right? And what your insurance is able to provide for you might be what you need, might not be what you need. You might have to supplement, or you may be able to take care of more things at home. So always consider that picture of what does financially, what does being discharged mean? Because for some people, it doesn't mean anything. I go home and I already have everything set up and I'm fine. For other people, it might mean you're being discharged to a place where you have to transition to long-term care, and there might be financial implications from there. Or you're going home and we're hiring help. How much of that is covered by insurance? How much of that isn't? And even towards end of life, not all the services you may need for end of life care at home or out of the hospital are covered by insurance, right? So the case manager is a nurse who's able to really speak to me medically, dive into the chart, understand what's happening, and then match all of that with what's going on in the community and how the community can support you when you're discharged.
Those case managers, those individuals are so key. And I know at Home Instead, we help a lot of families transition home. And back when I worked in our local franchise, the case managers and I knew each other well because we were communicating a lot about that transition home. And so I think you make such a great point about, have to kind of consider it from all those perspectives. And that can be an overwhelming time for families, especially, if they're being told, okay, your loved one is being sent home, but they need 24/7 supervision, or they have to go to a short-term rehab facility, or maybe it's time for a long-term placement in a care setting like a nursing home or assisted living. And at a time when it can already be so stressful, those decisions can, feel like they're carrying so much weight. And so I try to encourage families to talk about those options for care far in advance of ever needing them.
Oh, yes.
But the reality is many times families are discussing these for the first time in these moments of discharge or crisis or a hospitalization. And so I think it's just good if people are listening to start thinking about the resources that you have or what's available in your community. And I think it also differs too, whether you're in a more rural setting or more urban setting, the choices and situations can be very different, but those case managers can be such an important resource.
And those are the people that I say, like, lay it all out. Give them every one of your deep, dark seated fears and let them know what really is going on at home and what really you're capable of. The number one thing that's going to cause you to come back to the hospital is if we discharge you and your capabilities do not match your needs. Right? If you go home and you can't manage your medications, you will be back in the hospital. If you go home and you are not safe in your physical environment, right? because you needed a walker, but you don't have a walker. You needed a shower chair, but you're slipping in the shower by yourself, right? If your needs are not met, if your capabilities cannot match your needs, you will fail and you will come back to the hospital. Mm. So tell the case manager everything.
Yeah, I think that nobody wants to go back to the hospital. So I think,
we love you, but we don't want you back in the hospital.
Right.
You know, you were lovely, but please, we want you to be successful out of the hospital. And what that looks like for different people is very different. Each one of us is very different. Some families are very medical and can do all sorts of things. I've met families where like 4 daughters are all ICU nurses. There is nothing that this, father can go home and need that they will not be able to do. That is rare. There are a lot more families who are like, oh, I'm uncomfortable with that wound. I don't like needles, or, we work a lot and they would be home by themselves.
Right.
And, that's not safe. And so you really do have to be really honest about what your capabilities are and what your needs are. And you want those two to match. You do.
Absolutely. Yeah, I think we all wish that we had 4 nurses in our family so that they could take care of all of that for us. But, as you mentioned, that's not a reality for many families. But I think, too, as part of that whole discharge, planning and conversation, voicing those concerns, as you said, laying it all out there, asking, is there any, training, or asking questions of the nursing staff that's around during your hospital stay, about maybe how to change the wound dressing, or those kinds of things, can hopefully help set the family up for success when they return home.
Oh, yes. Speaking with your nursing staff about what someone's needs are moment to moment gives you a wealth of knowledge. I use that in family meetings as well. I'll invite the nurse, to say like, hey, what have you noticed they've needed? What do you see that they're doing at nighttime? Are they sundowning? Things like that. Mm-hmm. And so have a conversation with your bedside nurse and say like, really, what's really going on with Dad? What's really going on with my husband? They kind of put on a strong face, but we're thinking about going home. Do you think we'll be successful? Like, how much work is it to do X, Y, and Z? There are nurses that, can do training on wounds. There's always diabetes nurses in the hospitals who will show you how to use needles and things like that. But there are a wealth of knowledge. So please utilize your nursing staff to find out, do our needs really match our capabilities? Can I really do that thing that is necessary?
Yeah, so many great points. And also, making sure too, as you mentioned, like the home environment is set up for success. Yes. And in some cases, having an occupational therapist, there might be the option to have them come into the home and kind of assess or make recommendations for that durable medical equipment that you mentioned, like the walker or the shower chair. Because we know so many homes are not set up for aging in place or returning home, from a hospital stay. And as you mentioned, life's going to look a little different. At least if not short term, maybe, forever for individuals that are hospitalized for various reasons. And so, I think it's, while it can maybe be overwhelming, it's really important to stop and think about the environment too, and how can we modify the environment to make them successful.
I call them prescriptions as well. In my book, I say that there's going to be several prescriptions that I give you. Some will be medications and others will not. Others will be the type of food that you eat. Others will be walkers. Those things are prescriptions as well. Those things are there for your safety. Those things are there for you to get better, right? The thing that's going to set you back is getting injured, right?
Yeah.
And so I have seen people make great recoveries, but it's a process. Recovery is a process. And just because you need a cane now or a walker now doesn't mean that you still need that in 3-4 months if you're going to physical rehab, if you're getting stronger, if things are different. But it will mean you need that if you fall down and you break a hip, you hurt your knee, right? So when I prescribe walkers or canes in the hospital, I say to them, I don't care what you do to this thing. If you bedazzle it, that's fine. If you get one for every outfit, even better. But this is my prescription for your safety. And I really want you to treat it like that.
I think that is so key, that some will be medication prescriptions and some will not, and to take them just as seriously.
You've got to take them the same.
Yeah. Well, and you mentioned medication management at several points as well as being so key. And I think that is an important point to maybe just double click on quick, because often there might be a change in the medication or a new medication introduced. And so that med list you walked into the hospital with for your loved one or the person you're caring for will probably look different as you leave the hospital. And so just preparing families for that reality and making sure that they're, getting the prescriptions filled and finding a way to make sure that they're taken accurately, maybe with food, without food, or at the right times throughout the day.
Yes. So there's a process in the hospital, or not just in the hospital, but in healthcare, called the medication reconciliation process. And that's when we take the list of the medications that you're taking at home, the medication we want you to take in the hospital, and we decide where they meet, which ones match, which ones are bad to take because they might interact or you're too sick to take. And then we make a list for the hospital. And then we do that again when it's time for you to be discharged. And we look at and we say, what are the meds they're taking in the hospital now? What should they be taking at home? How can we make these two lists mix and match safely for the patient? And what I encourage patients and their families and caretakers to do is two things. One, when you're being discharged, you get that list, that med list, and you're going to ask every question under the sun. You're going to take a pen out and you're going to make notes, right? Things you should not accept is, it's written down. Correct, it is. And I still have a question, okay? To make sure you know what the medication is and when they should be taking it. Some medicines will have a limited amount of time. Antibiotics, for example, I'll prescribe you 5 more days of antibiotics, right? And some you might not be able to take until later, right? I might say, don't take this diuretic until you're done with the antibiotic because they interact, right? So that's why you are going to ask every single question, because you want to go home and you want to be taking the right medicines. So after you've asked every question and you have your marked up paper with all of your notes, you're going to go home and take that paper. You're going to do that with your medicine cabinet. And you're going to say, okay, what here do I need to be taking? What was I instructed to stop taking? And what are the new meds from the pharmacy that I just picked up, so that everything matches and you're taking them correctly and safely? I said 2 things. I lied. Then the third thing you're going to do, is you're going to take that list and that bag of medicine with you to your primary care doctor. And they're going to go through that process again when they see you in a week or a few days after discharge, so that someone is laid eyed and said, okay, 5 days of antibiotics are done. We'll take that off of your medication list. And now it's safe to restart this diuretic. So now here's the new list of medicines that you're taking, right? Yeah. And this is why I say hospital stays rarely make things easier. They just make things different. There's lots of different things going on. Getting better, recuperating, recovering is a process. It's a journey, right? Things like diagnoses may change over time, right? You go see your primary care doctor. Oh, the biopsy is back. Now we have more information. Now you get a new referral to a specialist that you didn't have in the hospital. So you've got to participate over and over and over again, because a hospital stay, it's just 4 or 5 days. The average hospital stay in this country is just 4 or 5 days, right? There's 360 to 359 more days, or 61 more days left, right? And that's a lot of time to fill, and a lot of things can happen. And so you want to be set up for success as much as possible.
Absolutely. Well, and getting to those follow-up appointments post-hospital stay, that is so, so key. And can sometimes be kind of logistically challenging. And so again, I think in that whole discharge discussion and planning, understanding, what follow-up appointments are going to be needed. Oftentimes they get scheduled, and making sure that, the person has transportation, or that the family caregiver can be there. I think those
Yeah.
are all kind of really key pieces to this whole discussion. And hopefully by doing all of these things, you can prevent a rehospitalization, at least for that same kind of incident.
Those things are hard.
Yeah.
The follow-up appointments are really hard. I encourage people start making those appointments while you're hospitalized. Because we'll say, I guarantee you, every discharge paperwork in America will say, follow up with primary care in 7 days. And if you try to call your primary care to get an appointment in 7 days, it's very difficult.
It's true.
So I tend to tell people, when we're talking about, well, you maybe go in a day or two, pick up the phone, start making those phone calls now, start getting those appointments set up as soon as possible. Because the other thing that I see happen is they will make appointments for you, which sounds great, except you have a life and a schedule.
Right. Yeah.
Right. Like I hated that when I was pregnant. I would just get a phone call that was like, you have an appointment. And I'm like, you don't know anything about my life. Like I'm actually working full day that day. I have to now change this. Right. So this is another thing. If you need to be there, if you need, as a caretaker, need to be there, right? You need to be proactive about those appointments. Don't just wait. Somebody else will make them for you or not, and they'll just get, dropped. But you should be really proactive about that and make sure that you can get to them in a way that is productive.
Such a good point. Yeah, there's nothing worse than having to try to rearrange your schedule to get to the doctor's appointment if you can kind of get ahead of it on the front end of it.
Yeah.
But this has all been such helpful information, Dr. Nugent.
Thank you.
And I know that we could probably spend hours discussing hospitalizations. And you're right, we didn't even really touch the ER. And let me tell you, I've been watching the show The Pit, and I've been fascinated by that show and the ER and everything that takes place. And what is interesting is they have incorporated some aging and caregiving into the plot line of that show. And I was like tapping my husband. I'm like, this is the world I live in. So anyway, I think it's,
you know what? They're mostly hospital medicine stuff they're doing there.
Yeah.
Like I'm always like, I've worked in all sorts of hospitals, and those ER docs don't want 87% of that stuff down there. They're calling me like, come get this patient now, so it is a great show. It is a great show. But that I thought was really, I loved that they are acknowledging
absolutely
that our population needs help.
Yeah. And caregivers come into the hospital so overwhelmed. And the social worker in that show, I think, does a great job of supporting a lot of the patients' families. And so again, tapping into those case managers, the nurses, the social workers within these hospital systems, they can be, such a great asset. Of course, in addition to the physicians and the nurses, and
it's a team. It's a team. It's
absolutely. Well, Dr. Nugent, as we wrap up our conversation today, any last thoughts or tips, anything we haven't covered that you want to be sure to share on this topic of hospitalizations and kind of making it as successful as possible?
Something that you touched on really, really quickly earlier was having conversations about your care goals shouldn't occur just in a hospital. Should occur at home, often, early, so that you're having these conversations and you're relaxed and you can talk about them, so that if something happens, you are hospitalized, the person you're caring for is hospitalized, and I'm here looking at you to make decisions. You've already had these conversations. You already have a plan. You're telling me what the goals are, and we're working together towards those goals. And too often, because it's a difficult and hard conversation to have, we gloss over it, and then we're left making decisions in crisis.
Right.
I encourage people, sit down with your loved ones and have conversations about, and I'm not speaking clearly, like solely about end of life stuff. I'm talking about everything, about goals. What are your goals? Do you want to age at home? How can we support you? Would you ever be open to a community? If you needed to, how do we financially plan for that? Caring for our aging population, caring for our medically complicated family members, is a process that can span years.
Yeah.
And so you have to have these conversations early and often.
Yeah. And also when there is a big health event, and things change, revisiting the conversation.
Revisiting,
to say,
yes.
Now circumstances are different. So because of that, how can we update these care goals, or what now are our options, or do we have to execute on some of what we have been talking about? So such a great point. And Dr. Nugent, we'll link to your book, your podcast in the show notes.
Thank you.
And then Home Instead, we also have what we call a free downloadable What's Next guide, and it helps families through conversations around healthcare, care needs, finances, living situations. So that could be another great resource in having those conversations early, and then reading your book, of course, to get even more of an inside scoop and more information on how to navigate these hospital stays. And
I love it. Use all the tools.
Exactly.
I love it. That's
There's
great.
so many tools out there. And that's one of the goals of this podcast, is helping people get the tools. So I'm so grateful to you, Dr. Nugent, for joining me today and for sharing.
Thank you for inviting me.
Yes. Oh, it was a pleasure. I learned a lot, and I know our listeners will have too. And maybe we'll have to have you back for that ER discussion in more depth, because we know families find themselves there often as well.
It's a hard place to be. So I understand.
Yeah. Well, thank you again.
Lakelyn.
A big thank you to Dr. Nugent for joining me and sharing her valuable wisdom. These insights remind us that while hospitalizations can feel overwhelming, families have the power to prepare, communicate, and advocate for better outcomes. To all of the caregivers listening, whether you've already experienced hospital stays with your loved one or want to be ready when the time comes, remember this: knowledge is power, and you don't have to face this alone. If today's episode was helpful, I'd love if you'd subscribe, leave a review, and share it with a fellow caregiver. I also love hearing from you, and you can reach me at caregiverchats@homeinsteadinc.com. Thanks for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com to learn more.